This is Community Connect, presented by Tampa General Hospital. I'm Amanda Wild. Joining me today are lead diabetes nurse specialist Laura Gill and Director of Diabetes Education and Clinical Nutrition Latoya Connor. Dr. Connor, Laura, welcome. I'm excited to hear your insights and expertise on diabetes. It's a disease that affects so many of us.
Yes, and we're so glad to be here today because conversations like this matter. And diabetes affects so many people, yet it's often misunderstood. And as diabetes educators, our passion has always been to help people move forward from fear and confusion to confidence and clarity. Because when people feel supported and informed, real change happens.
So, Laura, can you share a little about what inspired you to become an educator?
Yes, I think back to early on in my career when I was working on a busy transplant unit and I was asked to translate diabetes education for a Spanish speaking patient. Even back then, I saw firsthand how overwhelming diabetes diagnosis can be. And diabetes shows up in almost every area of healthcare. But education is what empowers patients and where lives truly change. Helping people understand their condition, feeling empowered, and regaining a sense of control has been the most meaningful part of my career.
This is interesting what you said about diabetes affecting so many people. I understand there are millions that don't even know they have the disease. Leads me to wonder, what are some of the common misconceptions you hear from patients or families about diabetes?
Yes, we definitely have that. And one of the biggest misconceptions is that diabetes is simply about willpower and doing everything perfectly. But in reality, diabetes is complex and influenced by genetics, hormones, stress, illness, and medication. So it's not about perfection, it's about progress, learning, and giving yourself grace along the way.
You lead a monthly support group for people living with diabetes, and I can already tell that you are on fire about this subject. What kind of impact have you seen these groups make in people's lives?
So, yeah, our support groups remind people that they're not alone. And I've seen individuals walk in feeling discouraged and leave feeling hopeful and connected. When people share experiences from one another and feel understood, it reduces fear and builds confidence in managing diabetes day to day.
You mentioned it can be an overwhelming diagnosis, Laura. For someone newly diagnosed with diabetes, what are the first steps you recommend they take to feel empowered rather than overwhelmed?
Yeah, so when somebody's newly diagnosed, my first advice to that person is to pause and breathe. So you don't have to learn everything all at once. Just start with small steps and ask questions and lean on your healthcare team. Diabetes is a journey, and empowerment comes from taking one manageable step at a time.
On that note, Dr. Connor, there is so much information out there. How can people know what diabetes advice or sources to trust?
Thank you, Amanda. There's a lot of information online, and not all information are always helpful and accurate, but I encourage our patients to just trust evidence-based sources like the American Diabetes Association as our number one cornerstone. If you have a certified diabetes educator when you show up at your appointments, and also always your providers who are providing care for you. If something promises a quick fix, that kind of sounds like a red flag. So we try to tell our patients not to just jump on every quick fix that's out there.
Mhm, mhm. What are some of the resources Tampa General Hospital provides to support people living with diabetes in our community, Dr. Connor?
Tampa General Hospital offers diabetes education, individualized counseling, structured classes, and ongoing support groups. We lead these twice monthly. We also help patients transition safely from our hospital stays when they're acutely ill to home by connecting them with outpatient resources and follow up appointments.
Dr. Connor, if you could give one message of hope or encouragement to anyone struggling with diabetes right now, what would that be?
One message of hope is if you think that you're failing, then you're not alone. Diabetes is challenging, but it does not define you. With education and support, self compassion, you can live a full and meaningful life. And we're always here to support.
Well, thank you so much, both of you, for sharing the ways in which education can provide support and empowerment for those of us suffering with diabetes.
Thank you for having us.
Thank you, Amanda.
That has been lead diabetes nurse specialist Laura Gill and director of diabetes education and clinical nutrition Dr. Latoya Connor. For more information, visit tgh.org/endo. If you enjoyed this episode, please be sure to like, subscribe, and follow Community Connect, presented by TGH, on your favorite podcast platform. I'm Amanda Wild, and this is Community Connect, presented by TGH. Thanks for listening.